the latest drugs for obesity, injectables for obesity, weekly shots, GLP-1s, semaglutides. Are you prescribing them? Who's it for? Are they safe? There's a lot of confusion around this, doctor.
31% of those people who skip breakfast are more prone to get belly fat. Around 48% of those people who skip breakfast have more prone to get overweight or obese. What you can see is every 1 in 4 person, men or a woman, they have either overweight or obesity.
A no-carb diet, no fat, keto diet, intermittent fasting. So which of these really work?
Let me be very clear, there is no one diet which anybody can follow and lose weight on that. There is no something like a weight loss diet. That's a wrong term.
What's your view on bariatric surgery? Do you advise it to people? Who's it for? How sustainable is it?
It's a wonderful thing, wonderful surgery. But again, to be done by looking at the risk versus benefits.
Hello everyone and welcome to the 21st episode of Conversations with Zyla. I'm Khushbu, founder at Zyla Health, and today I have the privilege to welcome Dr. Parjeet Kaur, Associate Director, Endocrinology at Medanta, Gurugram, on Conversations with Zyla. Thank you, Doctor, for joining us today.
Thank you, Khushbu, for inviting me.
Thank you. Dr. Kaur has a studied career. She is an alumnus of AIIMS New Delhi. She's spent 2 decades on endocrinology as a practice and also practiced at Mayo Clinic, United States and AIIMS New Delhi. She is a marathoner herself and has treated numerous patients on not just long-term metabolic health, but also sustainable weight loss. So Dr. Kaur, a very, very important topic to discuss today. More than 60% of the users we serve at Zyla are either overweight or obese. And most of them, are working professionals living in tier 1 cities. So we want to bust some myths today on what really is causing this weight gain and how do you sustainably manage your health for long-term health outcomes. So first and foremost, Dr. Kaur, if you could cover about obesity in India, what is the current statistic and what is the penetration of obesity that you see, especially in working professionals?
Right, so obesity is definitely increasing, and over the year of I think this is a National Family Health Survey which clearly showed that over the last 15 years the rates have gone 3 times or 4 times high. So currently around 30% of 25 to 30% of both men and women have obesity or either overweight. What you can see is every 1 in 4 person, men or a woman, they have either overweight or obesity. It's not only in the adults. I would say the obesity incidence is rising crazily in children as well. So if they see the data there, the childhood obesity rates, they have gone tripled over the last decade. That's much more alarming because the childhood obesity is definitely going to convert it into adulthood obesity and much more diseases in future. So there's alarmingly rising rates of both overweight and obesity in India.
Right. And India as a country is genetically very specially predisposed, I would say, right? Yes. We see people who are really thin outside, but there is fat inside or very visible on the belly. Yes. Why is this trait specifically visible in India, doctor?
Yes, this kind of phenotype is talking about thin outside and fat inside, what we call toffee phenotype also. One thing is very clear, genetics has a huge role to play in this. So we Asian Indians, we have different genetics as compared to our Western counterparts. And that's why we develop diseases even at a lower BMI. So if you see Western counterpart, they have even classification of obesity at a BMI of more than 30. Whereas in India, we call a person obese if they have BMI of more than 25. And now even the more emphasis is on the lower BMI. The fact is because even at lower BMI, they have more fat on their belly. And what it means that they have more of a visceral fat. Visceral means once their fat is more on the central area, that fat is spilled over into their organs. Important organs being the liver, the pancreas, the heart. What we see frequently these days is the fatty liver. So this kind of a fat distribution which they have, the more of a visceral obesity, is much more dangerous actually than the generalized obesity. And that's why we Indians, we get diseases at much younger age as compared to the Western counterpart, like
Got it.
diabetes getting they earlier, like 10 to 20 years earlier than the Western counterparts. So this kind of a phenotype is much more dangerous. And another reason of being such a different phenotype in Asian Indians, not beyond genetics, is the kind of diet we are having. We have less protein in our diet, we have less muscle mass also, and we have more of refined carb. That is also predisposing us to get more of a central fat distribution rather than the generalized obesity.
Right. So what you're saying is if there's fat on your stomach, there's likely fat on majority of your organs,
Yes,
and that is
definitely.
leading to these different
Yes,
diseases.
definitely. Fat on the liver, especially, causes insulin resistance. And that's the beginning point. And that starts way more earlier than before you get diabetes or pre-diabetes or any other issues.
Right.
So this is the and those kind of fat deposition on our organs predisposes to you to get more inflammation in the body. So more is the inflammation, more is going to be the problems in the future.
Got it. And Dr. Zyla, we've seen, a lot of cases of parents coming in because we serve corporates. So parents asking about their teenager kids who have high sugar levels or cholesterol in the report at the age of, between 12 to 20. Is this something you're seeing as a trend, not just obesity, but diseases as a result of it?
Yes, definitely. So I'm seeing more and more kids now coming to me for obesity or being overweight, and I'm very happy. Also, people are now aware that they're bringing their parents, are bringing their kids. That's what I'm discussing. That these kind of overweight and obesity incidences are also rising in teenagers in childhood, and the main factor behind them, of course, they're genetically predisposed because they're carrying their genes from the parents, but at the same time the lifestyle factors have a huge role to play in kids, the teenagers and the children, because of the more of the screen time, less of the physical activity, and the diet, more emphasis on the outside food, the processed food, the easy food, the munching, and the more of sitting time. And it's a huge, in fact, now the diabetes are also we are seeing in teenagers, not only the overweight or obesity, they're already getting converted into the more bigger problems, getting diabetes in much younger age. Yeah.
Right. So is it right to say that obesity is actually the root cause of majority of these conditions?
Definitely. Obesity is actually the mother of all non communicable diseases, which we call
Okay.
diabetes, heart diseases, cholesterol issue, blood pressure, stroke, sleep apnea. Many issues actually are contributed because obesity itself can cause more than 200 diseases if you start counting from
Wow.
head to toe.
And Dr. Kaur, is it true that obesity causes cancer as well?
Yes, absolutely. Obesity is clearly linked with increased incidence of cancers. There are many cancers associated with obesity, including breast cancer, colon cancers, many more. So, no doubt, obesity not only with diabetes or other problems, but cancers as well.
Got it. So we've established it's a growing concern, and we've established that it causes 200 plus diseases from head to toe, as you said. So now just coming to the root causes and, eventually how we fix it. So a lot of people come to us and say that, it's not my problem, it is in my family, right? So you did mention a genetic linkage, Dr. Kaur. But what percentage is really attributed to genetics? And if in my family I have people with obesity, does it mean I can never have a healthy weight?
Okay, yes. So no doubt genetics have a huge role to play. Genetics actually contribute 40 to 50% of your risk of getting obese or overweight in life. But at the same time, I would say genetics are there just to load your gun, but the trigger is the lifestyle, right? So if you're able to maintain a healthy lifestyle, that is not going to get manifested. So it's not just genetics. Of course, genetics has a huge role, and people do get difficulty in losing weight, or they gain weight very fast if they're genetically predisposed. But if they're able to maintain a healthy lifestyle in terms of diet and exercise, definitely they can be healthy. If not the weight, but they can be at least metabolically healthy with their own efforts.
Got it. So genetics is not really a limiting factor for you.
Definitely
You
not
can
a
still
limiting factor.
got
Yeah.
it. Okay. And what about hormones, right? A lot of people blame it on the hormones that I have a hormonal disorder, I have
Yes.
thyroid problems, I have PCOD, hence I'm gaining weight. Is it mixing up the cause and effect to some extent?
It's a very good question, Khushbu. I think I face this a lot when patients come to me and they would say, Doctor, something big problem with my hormones that I'm not able to lose weight. So what I try to explain them, it's in fact the other way around. Once you start gaining weight, then your hormones start getting disturbed.
Right.
The only one hormone which in fact start getting disrupted or dysregulated in obesity is the insulin hormone. So insulin is a natural hormone which controls our blood sugar levels. But as I just mentioned earlier also, if your lifestyle is poor from the beginning, from the childhood, this insulin resistance sets in, and that's when you get a more tendency to get overweight and obesity. But then again, this is again linked to lifestyle. It's not that hormone is causing the problem. The lifestyle first, then the hormonal problem, then the obesity, and then the hormonal problems once more. In fact, the thyroid problems which you're talking about, this is a big myth that somebody who has hypothyroidism will gain weight. It's not that. Maybe a 1 or 2 kg of weight gain because of fluid retention. In fact, what we see is people who are obese, their thyroid levels get disturbed and unnecessarily they're put on medications. So if they lose weight, in fact, the thyroid hormone levels get better. So actually, it's the other way around. The weight causes problems.
So it's a
with
vicious
thyroid.
circle.
It's a vicious circle, yeah.
Weight leads to these conditions. These conditions lead to hormonal imbalance, which further worsens these conditions.
Right, right.
Got it. And how about some certain medicines which people are on, and they say that, hey, I'm on this medicine, and hence I'm gaining weight. It's not in my hands.
Yeah. So definitely there are certain medications. So whenever we see a person with obesity or overweight, do look into the medications list. So one is the medication is steroids, which are not commonly used, but many times it's used for certain conditions like joint pains or arthritis. It's commonly used. In fact, many people start using some kind of alternative therapies which also do contain steroids. We need to be aware of that. Other therapies like antidepressants, antipsychotics. No, we are facing this problem. You also know that this kind of, I think in lifestyle, the stress is one more component which often get ignored. So people are more getting treated with these kind of medications. So these also sometimes contribute to the weight gain, or at least kind of become a barrier in losing weight. So there are certain medications, and there are seizure medications, anti-epileptics. Also, they make
So
someone
such
prone.
people have to work harder on their lifestyle.
Yes, they will
If
have
you're
to.
on steroids or on an antidepressant or
Yes.
anti-anxiety drug.
Yes.
Got it. And what about weight gain after, as in a postpartum stage? A lot of women in India, they say that, it happened after I had a kid. I'm doing all household chores, but still, I'm not able to lose weight. Do you hear that often?
Yes, very often. I think this is a common problem. So postpartum weight gain happens due to several reasons. First of all, there is always a predisposition to that. That's why we always say take care of your pre-pregnancy weight. Before you plan pregnancy, get a good weight and then you plan pregnancy. If somebody is already overweight and obese before pregnancy, and then there is a tendency to gain weight during pregnancy, and there are myths around that as well. People think gaining more weight is good in pregnancy. It's not that. In fact, if you're already overweight and obese, you should gain just 6 to 7 kgs during pregnancy. There are certain goals, targets set already for that. So one is that predisposition. Secondly, in postpartum, of course, again the diet comes into big role, because these women are fed with high calorie food, sugary foods, all those cultural things are there. So start gaining weight, and then the physical activity, of course, is not much as it would be before pregnancy. Also, although they're doing household chores, but that's not enough to lose weight. So I definitely would say it's a big struggle postpartum, but if taken baby steps and worked gradually towards diet and exercise, they can definitely lose the weight whatever they have gained postpartum.
Got it. Great. Thank you so much, Dr. Kaur, for sharing that. To a lovely audience, please keep putting your questions in the chat, and we'll try to pick a few while my team will answer the rest. Okay, so Dr. Kaur, now the audience is very, very interested in hearing about fat diets and weight loss diets from you. Right, so let's pick it one by one, because there's just a plethora of things here confusing people. The first one is around sugar itself, right? So now we've read and heard that sugar is causing inflammation in the body that is leading to obesity and all of these conditions. Inflammation itself has become the big villain, and sugar the big causative factor. So personally, I have seen, if I tell you my story, that I rarely take white sugar, right? I'm completely off it. And I feel when I don't take it, and I stopped it a couple of years back completely, I just feel more energetic, and
Right.
I feel that I don't get any sort of bloating or, morning acidity. I just feel that it was not doing any good to my body.
Right.
But what is a doctor's take on sugar and inflammation?
Right. So, sugar as such, I would say it's a very calorie dense food, right? So even if you take a lesser quantity, the calories delivered will be much more, which of course puts you at high risk of gaining weight. But at the same time, insulin resistance comes up very fast. If you take sugars on a daily basis, what sugar does is it produces insulin, it stimulates your pancreas cells to produce insulin. So, if you're already in a stage where you are insulin resistant and more insulin is produced, insulin levels start going up. And what these insulin levels do, the high levels, they cause lethargy, they cause inflammation, they produce more hunger, in fact, and more craving for sugar. So people who take actually more sugar, have more craving also. That becomes again a vicious cycle. So sugar has a big role for the inflammation. It causes in the body to release pro-inflammatory cytokines. These are like chemicals in our body, which again produces more of insulin resistance, more of fatty liver and fatty pancreas, and more problems. So definitely, this refined white sugar, in fact, sugar as such, is not
So
healthy.
there is no benefit of white sugar, right?
No,
It's
no, not.
completely okay to eradicate it
No,
from
we
your diet.
completely eradicate, of course. Sometimes we do say, okay, somebody who's such a living a balanced, healthy diet and occasional eating is not a problem, but not on a daily or a regular basis.
Got it.
Yeah.
And one thing we hear very often, doctor, is that, I've just been through a stressful episode. I had a heartbreak. I had a tough exam. I had a bad promotion. So I need to indulge. And, next few days, I'm just going to indulge on desserts and foods of my liking. It's my cheat week. So people use sugar as a fighting mechanism for stress.
Right.
Now, if someone is going through a stressful period and you think sugar is going to worsen things, right?
Right.
What else could they bank upon?
Of course, at that point, it will be difficult to bank upon something else. But definitely, sugar is very addictive. As you rightly said, they bank upon sugar. So, sugar is in fact 8% more addictive than cocaine, it has been found.
Wow.
It's so addictive. So, first step is to have that kind of awareness, like being mindful of what you're going through. So if you're aware and mindful that whatever you're doing right now is going to produce long term harm, that's where I think people can stop. I would say at that point of time, if they can just take a quick break, go for a walk outside, or maybe just take a quick break and meet your friends and talk about your problems, or take a fresh air, go for a nature walk, drink water, eat fruits. They are also sweet. In fact, I always say to my patients who have diabetes, they want something sweet after meal, maybe a bite or two of a fruit will also help. I think this kind of diversion is much needed at that point of time, so that they do not bank upon sugar. This is gonna
No,
create
that's
problem.
amazing,
Yeah.
Dr. Kaur. Otherwise, it again leads to a vicious
Yes.
circle of,
Yes. Insulin
almost a eating
resistance.
disorder where you keep craving more and more because
Yes.
you're in stress.
Yes.
Okay. And what about things like milk and gluten? They are the other two big villains, right? And related to inflammation.
Right.
So, how much to take, how much to avoid?
Yes. So I would say they are not the big villains at all. Again, what we need is a moderation. As far as the milk is concerned, it's protein and calcium rich. That's not a problem at all. As long as it's low fat, what we call as toned or a double toned milk, is very good. Can be taken in quantity, as I was in layman term, I would say 2 glasses a day won't harm at all. Okay, as long as there is no other restriction on your fluid intake. Gluten again is not a villain at all. Again, the moderation is a concern here. So, gluten, what is found in the wheat, primarily what we eat, is the chapatis. So, there, if we restrict our gluten intake in the form of cutting down on the number of chapatis you're having, or mixing your gluten with some millets, mixing your wheat with the millets like bajra, jowar, ragi, and all, it improves the glycemic index of it. So, as such, gluten, wheat, if consumed in excess quantity, is definitely going to cause a problem. It will create inflammation, increase your body weight. But when restricted in amount, for example, in your plate, if it just one fourth is the gluten, that's not be a problem. And preferably, if combined with the millets and complex carb, that should not be a problem. That it's not necessary to completely remove it. I have seen people doing it, and the problem is that's not sustainable. You have to do something which is sustainable. If you're ready to quit gluten for lifelong, that's fine. Okay, do it. Like, people have celiac disease, they do not take gluten, but they are committed to it for the lifelong. But if it's not sustainable, there's no point doing it, and just take it in moderation. That's fine
So
then.
do something which you can do for a lifetime.
Exactly.
Got it. Okay, and doctor, now we are seeing some questions coming from the team on the chat. So I'll cover a theme which is on these diets, a no carb diet, no fat, keto diet, intermittent fasting. So which of these really work? And sometimes when we stick to some of them, why doesn't the weight loss sustain?
Right. So let me be very clear, there is no one diet which anybody can follow and lose weight on that. There is no something like a weight loss diet. That's a wrong term to be used. Now, there are many diets definitely have been tried, and research has also been done on keto diets and intermittent fasting and all. But what it boils down to is a calorie restriction. That is what works. If you have restricted your calories in a day, even if you're eating 3 meals in a day, but you have restricted your calories, and at the same time, if you're focusing on the quality of the food, that's much more important than going towards a specific kind of a diet. So, with these diets, it's a problem, especially with the keto diet, it's a big problem. It will definitely cause a huge weight loss in the beginning, but that's not at all a sustainable diet. You can't just thrive on fat and protein throughout your life. And the moment you change to a normal diet, you gain weight because it's not a sustainable, it's not doing for life forever. Similarly, intermittent fasting, definitely it also shows good results. It's only meant for those people who are highly motivated. They know they will be able to do it or are done under supervision. So some people, they just do, their own kind of intermittent fasting. Oh, I haven't eaten for these many hours, that means I'm intermittent fasting. No, that's not the way. And those 2 meals they are eating like full calorie and not taking care of the quality of the food. So diet, I would say something should be culturally sustainable diet. It should be a protein adequate diet, and that should be a balanced one. And most important, I would say sustainability. Be consistent with whatever changes you are making. Do not go for any fat diets, keto diets, or intermittent fasting. Yeah.
And you rightly said there is no weight loss diet.
No weight loss diet,
Correct.
definitely.
That was a great statement. And Dr. Kaur, we hear a lot of complaints from vegetarians, right? That my doctor says I must take protein if I have to have a healthy weight, have a balanced diet. But you know what? What do I have for protein if I'm a vegetarian? So, what do you guide your patients in such cases?
Yes, definitely. The first question I ask my patients, are you vegetarian, non-vegetarian? So vegetarian, it's a big challenge, especially because we know we need the protein at least 1 gram per kg of your weight, ideal body weight, let's say 60, 70 gram, most of the people would need it, right? So in vegetarian diet, there are good sources. Dairy is actually a very good source, what we're talking about, milk. It gives a good amount of protein. That's why people should not exclude dairy from their diet. Dairy products, curd, milk, paneer, these are very good sources. Then we have pulses, soya bean, then the rajma, chole, sprouts. The challenge is that how to incorporate it, right? People have usually this diet like chapati, dal, sabzi, and that's done with it. So we need to be mindful that in every meal, we must be having some 20 to 30 grams of protein. So let's say in the morning, you can have a glass of milk along with a bowl of sprouts, should be enough. At lunch, if you have around 200 to 250 grams of curd, should be enough. In the evening, as a snacks, you can have a raw paneer or a boiled soya bean chaat kind of a thing. Night you can have pulses, dal. So being mindful is very important. Although you know all these items have, unless you incorporate it consciously, you won't be able to do it. So it
Right.
is possible. Difficult, but it is possible.
And if
Yeah.
you eat eggs, then it's much easier.
Oh, definitely. It's much easier then.
Got it. Great. And just talking about some other aspects of now losing weight apart from diet, Dr. Kaur. One is on exercise, right? And now there is a lot of debate, and on social media, different camps on cardio versus weight loss versus 10,000 steps a day. So, what is sustainable for weight loss?
Right. So again, combination works the best. combination of a good cardio and a strength training is must. So what I see people what they do, I think majority would say if I ask them, okay, what kind of exercise they do, happily they would say they do walk, which is a very good thing actually. If you're able to walk for on a daily basis 30 to 40 minutes a day, that's a kind of a good cardio. But there's a lot of lack of awareness on the strength training part, and that's where we were talking about the kind of phenotype we have, the toffee phenotype, the thin outside and the fat inside, is because we have low muscle mass.
Right.
So there should be an equal emphasis on the strength training. So what combination works best is actually ideally is the at least 5 days of a cardio, 30 to 40 minutes a day, could be in the form of a brisk walk, or if you're going to gym, then treadmill, elliptical, cycling, swimming, it's a good cardio. Dancing, if you like dancing, go for dancing, Zumba, combined with 2 to 3 days in a week of a good strength training. Now the challenge with the strength training, people think they have to go to gym, how will they take out time? But let me be very clear, these kind of strength training sessions can be done at home also, without any equipment, without any weights, just with your body weights. If you do it proper, like for example squats,
Right.
incline push-ups, lunges, they do not need any weights, but doing properly in sets and repetitions. Now the thing is, we need to be more practical how to start with. So whenever somebody is starting their exercise journey, I always say start by just moving more. That's much more important to begin with. If you have a sitting work, make sure that you can get up after every 30 to 60 minutes. Just even standing also for a few seconds helps actually. And then taking a post meal walk. After every meal, taking 10 to 15 minutes of walk. If you do not have a dedicated time for exercise, 30 to 40 minutes, do it in a short breaks. What we call it exercise snacks. Okay, like do it in the evening for 10 15 minutes, go for a short walk around the office and come back. Increase the number of steps. As far as your 10,000 steps are concerned, again, this is not a golden rule here that you have to do this much. But what the data has shown is actually at least a minimum of 8,000 steps definitely improves your fitness much more than. So gradually aim towards that. Do not be get hassled by that we have to do every day this much. Gradually increasing more mobility, I would say movements, and then incorporating strength training, that's the best combination. That's a sustainable, because here the goal is not only the weight, it's about improving your body composition, like
Right.
getting your muscles strong. More the muscles are better, metabolism becomes better, and you lose weight faster.
Got it. And there's a question we have on the chat, doctor, related to this, and it is whether gym is safe or not, and who should go to the gym and for how long.
Yes.
I think because of a lot of these adverse
Incidents.
events in gyms, people
Yeah.
are now more cautious.
Right. So it may be like what those adverse events which had happened, those are the reports which have been happening earlier also. It's not that they were not happening. Gym is definitely safe, no doubt. But how to do it, what intensity to do it, it's somebody has to be guided upon, right? If somebody starts to, okay, I'm going to gym today and lift heavy weights, that's not advisable. It's better if you have already some disease like diabetes or anything, get your baseline cardiac workup done, and then you go accordingly. Otherwise gym is very safe, but the gym is important to always start with the low intensity. As I just mentioned, start with just your body weight. Gradually building up the weight is the key here, not doing with the heavy weights from the day one. Gradually increasing the intensity and doing in a proper posture, that's very important, so that you don't get injured, because I have seen people starting gym getting injured and leaving it. So posture is important, intensity is important, guidance, supervision, getting your blood work also the side by side, it's very safe.
Got it. So do it under a trainer, and I think you
Yes.
also have to keep monitoring your vitals, like your
Exactly.
pulse, when you're at the gym.
Right, you can do that. We have smartwatches these days. We can be easily done by that, yeah.
Great. Okay, and now, doctor, after diet and exercise, there's some shortcuts that people, in double quotes, shortcuts for weight loss
Yes.
that people are thinking about. What's your view on bariatric surgery? Do you advise it to people? Who's it for? How sustainable is it?
Okay, so for bariatric surgery, there are clear guidelines actually. So where we prefer bariatric surgery, if somebody has already failed diet, exercise, and pharmacotherapy, and somebody is along with that has problems like diabetes, heart diseases, cholesterol issues, then no doubt this kind of a bariatric surgery is even indicated at BMI more than 27 also. We have a lower cutoff again in Indians as compared to the Western counterparts because we are more prone to get diseases even at lower BMI. It's clearly indicated above the BMI of 33, even without comorbidities. So we have certain guidelines for that for bariatric surgery. It's not again a shortcut that you don't doing anything. I just want to go, and even the bariatric surgeon will not touch you. He's gonna give you at least 6 months of time to try from your side first to lose weight and then go ahead with that. It's a wonderful thing, wonderful surgery, but again to be done by looking at the risk versus benefits. Who will benefit the more? The ideal candidate should be the selected. Yeah.
And then is it sustainable weight loss or?
So bariatric surgery again, after around 10 years, that does start gaining, but at least it sustains for 10 years. Again, gradual regain might happen if your lifestyle is bad. Again, the focus has to be there. A lifestyle is not going to go anywhere. If somebody is doing a good amount of the structured exercise which we just discussed and a good diet plan, the chances are very less. Yes, but they do regain gradually, but not to the same amount which they were earlier. They might
Got
regain
it.
some weight.
Okay, now addressing the elephant in the room, which is the latest drugs for obesity, injectables for obesity, weekly shots, GLP ones, semaglutides. Are you prescribing them? Who's it for? Are they safe? There's a lot of
Yes.
confusion around this, doctor.
Yes,
We
lot
must
of
clear.
confusion, lot of confusion. I deal with it every day. So let me start with telling first that obesity is a disease. It's a medical condition. It's a chronic disease. It needs a lifelong management. Obesity is not just a cosmetic thing to begin with. So that's why these drugs are, I would not call it a weight loss drugs. These drugs are actually medicines. These are the medicines which were initially developed for people who had diabetes. But as a side effect, they saw that these medicines cause weight loss. So that's how these medications were developed further, and they were now approved for people for obesity, even if they do not have diabetes, right? We have two indications here clearly: somebody who has diabetes and overweight and obese, or even people who do not have diabetes for obesity. So, one thing is very clear here: very safe drugs, no doubt about it, only if used for the right person and under supervision. So, the clear indications of using these drugs are in people either they have diabetes and they have obesity and they're not able to lose weight, or they're not able to control their blood sugar levels with their own effort, then definitely these drugs are wonderful. Even if they're doing their lifestyle modifications, we still add these medications to them because they literally help them losing weight. Some people, they are able to stop their insulin also because of these medications, and these medications not only control your blood sugars and weight, they're very much protective for your heart, liver and kidney. So these medications have shown to reduce the heart attacks in future, protect your kidney. It kind of helps in improving the fatty liver. And so this is the kind of indication we have at BMI of more than 27. If you have associated diabetes or a heart disease or a cholesterol issue, or you have a sleep apnea problem, or you have osteoarthritis of knee, for all these is clearly indicated. If you have a BMI of more than 30, and if you do not have these indications also associated comorbidities, still it is indicated. Why? Because we know that at more than 30 BMI you are prone to get diseases in future. So there are clear guidelines, clear indications for use of these medications. Very safe, wonderful drugs, no major side effects, but only to be used the right person and under supervision.
Got it. So, doctor, but we have celebrities who are not above BMI 27, may not have conditions, and using it for cosmetic reasons, I think, which is creating confusion.
Definitely.
So, what is your take on
Yeah,
that?
yeah. So, in fact, what we recently saw, that Ozempic lawsuit happening in US. So Ozempic, in fact, was a drug which was meant only for type 2 diabetes, and celebrities took it for weight loss, which is not even indicated for weight loss, right? So the problem happening there is that if they're not taking for the right indication, not taking under supervision, they are facing more problems. More problems in the sense, the main problem it causes the gut side effects. Lot of nausea, bloating, their appetite goes down, their nutrition goes down. They do not know how to cope up with the nutrition. They get a lot of muscle mass loss, and that's why we call Ozempic faces, which they get because they're not aware of these things. They do not know how to escalate the dose because there is a very gradual dose escalation of these medications. So when these celebrities they're taking it off label without any indication, just for the weight loss, just for the cosmetic purpose, then it creates a problem. And it's not a shortcut. We if you accept that okay, you have obesity, then accept that it's a medical condition. It will need a lifelong management. It's not that we take medicine for few months and then you just leave it and things will be fine. So
Right.
yeah, it's not. I mean, like, I think the bottom line here is it's not a cosmetic drug. It's a
Right. So we have a
medicine.
question on this, doctor, on the chat, and there's a theme, which is on how long does it have to be taken in both cases with a condition or just for obesity? And if I stop taking it later, does it bring my weight back?
Right. It's again a very important question. If taken for condition like diabetes, or if already somebody has a diabetes or a heart problem or a fatty liver, or another major issue like obstructive sleep apnea, so these drugs are actually meant for a little longer time. So we do not have a clear answer as yet for how long, whether lifelong or not, that can we not comment upon. But a fair amount of time, at least we have good data of about 7 to 8 years now that these drugs are being used, and very safe medications. So if given for a condition like this, should be continued. We should not hurry up and should not be. Yeah, yes, patients do ask me, डॉक्टर साहब बस एक साल लेके क्या छोड़ सकते हैं? No, that's not the way. They need to be ready. This is a diabetes medicine and you should take because this has multiple other benefits. As far as the just obesity and no other associated comorbidity like I mentioned above BMI 30, there again it's advisable to take it for a little longer time, at least a year and more and a half, and then gradual tapering of the medication. But what's more important is along with that is lifestyle changes. You need to be committed. If you're committed enough and motivated enough for your lifestyle changes in the form of a structured exercise and a diet plan, that's where we decide, okay, we can wean you off from this drug and you should be able to maintain your own weight.
Right. And then there's another question on I had someone started on this medicine, but they had severe cases of nausea and stomach problems. How permanent is that?
Okay. So the gut side effects, the GI side effects are the most common with these drugs, and the most common being the nausea, the bloating sensation, loss of appetite. Majority, 95%, they are mild to moderate, and they stay for maximum 3 months, 4 months. Then body gets adjusted to it. So these initial months are always struggling. That's why we start the dose, the very low dose, and gradually build it up depending upon the patient's tolerability. We call them for follow up and see how they're tolerating. We never advise them to increase the dose on their own. Okay, next month you do this, next month you do that. So gradual escalation is important. Yes, rarely we do get severe cases where they have vomiting, diarrhea. We definitely give a break at that time point of time, stop the medication, hold the medication for some time, and then try to restart. So all these side effects definitely need to be supervised, and hence it's very important to be taken under doctor supervision only.
Got it. But what percentage of patients get very severe side effects, doctor?
I
That would
would
be low,
say
right?
very low, 1 to 2%. I would say
Okay.
one
So
to two
majority of
percent.
them have very,
Oh,
very mild
great.
side effects. Got it. Great. So we've discussed everything around, ways to lose weight. But we have some more interesting questions. Can black coffee help me lose weight?
Okay. So, no, not only the black coffee, but black coffee bit can suppress your appetite a little bit, but it's not the answer. Black coffee, as such, is good if taken in 2 to 3 cups in a day, has shown to improve your fatty liver. It does help in liver, but not really required to lose weight actually. But can be a good substitute if you're fond of drinking coffee, then black coffee will be a
Without sugar.
without sugar. Oh, no doubt about it. Yeah.
Okay, so Dr. Given, we have a lot of corporate audience today, watching this. One key theme we see as a problem, and we look at a lot of data, is alcohol and smoking, which leads to, again, inflammation and weight gain. So a lot of people believe that 30 ml of alcohol से तो कुछ नहीं होगा, इतना तो ले ही सकते हैं.
Right.
So what is your view on that?
Okay. Yes. So alcohol, I would say any amount of alcohol is dangerous.
So glad you said that.
Yes. Any amount is dangerous because it's not only linked with your inflammation or diabetes or heart disease, it's also linked with your cancers. So one thing has to be very clear. But at the same time, when people talk about it, who drink, if you're living a very healthy and a balanced way, you are taking care of your diet and exercise part, then occasional 30 ml is okay, not every day 30 ml. Occasional social drinking 30 ml should be okay if everything else is balanced. But
Like
if
once a month.
right, once a month, yeah.
And what about smoking?
Smoking should be absolute no, I would say. Smoking, because of course it also causes insulin resistance, but smoking is much more dangerous, associated with cancers, lung cancers, and clearly has direct relation with the heart attacks. So if someone who was already suffering from diseases, heart attack risk is high, smoking will double it up. Smoking should be actually absolutely
Right.
no,
And
yeah.
do all of these things cause inflammation of the body, Dr. Kaur, and how?
Yes, even the smoking and alcohol both cause inflammation. So again, the mechanism is the inflammation is causing the insulin resistance. And once the insulin resistance is there, these pro-inflammatory cytokines being released in the body and again more causing insulin resistance. So these things, smoking and alcohol, are clearly linked, not only direct link, but I would say disturbing your lifestyle overall, disturbing your sleep, disturbing your diet and exercise pattern. That also will indirect effects also there in causing inflammation.
Got it. Got it. So, Dr. Kaur, one, given, we're talking about working professionals, sleep cycle itself becomes a causative factor for a lot of diseases. And now OTT addiction is a key reason why people expose themselves to blue light at night. Eventually, the sleep cycle gets disrupted. Is sleep directly related to weight gain?
Yes, sleep has quite a linear relationship, I would say, with the weight gain. Poor quality and the less hours of sleep is clearly associated with weight gain and obesity, and somebody who's trying to lose weight would not be able to do that. And that's how, in the lifestyle factors, not only the diet, exercise, stress, but sleep is equally important. So, getting good sleep, at least 7+ hours of sleep, and again, the quality of sleep does matter. And in the sleep, I would add upon here a condition called sleep apnea.
Right.
Many people are not aware of it. People who are obese and overweight, they're much more prone to it. So, if you're snoring at night and at daytime you're feeling lethargic and sleepy, which means you could be having sleep apnea, so you must get a test called sleep study to figure it out. So sleep has very big role to play and should be equally emphasized upon as we do with diet and exercise.
Right. And what about stress? As of course, we discussed that stress leads to binge eating,
Yes.
improper eating, but stress in general, does it have hormonal pathways linked to weight gain?
Yes, stress has huge impact on the hormonal pathways because the main master gland, hormone gland, is in the brain, right? And we have all the stress centers, eating centers, everything is in the brain. They're clearly closely linked with it. So stress definitely causes problem in terms of your insulin resistance. It can disturb periods in women, cause menstrual irregularities, and in fact, girls having PCOS, they get their hormones more disturbed in the presence of stress. Stress also increases directly your blood sugar levels. So it has a huge link with almost every problem. So it has to be managed well. Yes, unless you are, I think, mentally healthy. I think it's a very interconnected
Connected,
thing.
yes.
Mentally healthy, and then physical health itself can improve your mental health. Yeah.
Got it. So, Dr. Kaur, when patients come to you and you see that they're trying to lose weight, some of them lose weight sustainably, some of them rebound the weight. What things have you seen working in patients for a sustainable weight loss? Some stories or examples you could share.
Yes, exactly. So, no doubt, sustainable weight loss is a big challenge. So, it needs a very high level of motivation. So, I do have few patients who worked very well actually with the help of these GLP-1 medications and their own effort. They could lose 40 kg around weight, and for last 3 years they're able to sustain it. So, what I see in them is, I think, prioritizing their health. What they do is taking out time every day, but I think prioritizing is something they understood. Okay, if health is, because they feel so good, then once they lose weight they feel more energetic, they're more productive at work, so they start giving emphasis upon that. I think that's what we need to see whenever we start our weight loss journey. Start seeing small results and let's get motivated by that. For example, feeling little energetic, getting good results in your blood work. it should keep you motivated, and that's how you should keep on going, taking baby steps. Don't expect a huge result. So in a weight loss journey, I would say always make two goals. One is the weight as a number, another one is your metabolic health. So with your own effort, you can get a lot of improvement in your blood work, metabolic health in just a month or a two time, and that should, I think, keep you motivated and keep you going
So a lot of mental
sustainable.
resilience at play here,
Yes, yes.
beyond the
No
ways
doubt
to lose
about
weight.
it. Yes.
So, Dr. Kaur, we'll just take some questions. People are quite interested in asking a lot of questions. I'll try to summarize as many as I can. So, one is on calorie counting. Does calorie counting help lose weight? What is the best calorie number for different weight brackets?
Right. So, calorie counting, as I was just mentioning, also calorie restriction does play a big role in weight loss, but it's not that you need to do calorie counting on a daily basis. Once you have understood, okay, this is the amount of food what you have to take on a daily basis, then it is could be just you can just alter the quality, quality. Like for example, today you are taking this meal, that mat meal, but the portion size once you have understood, then you don't have to do it on a daily basis. As far as the calorie count is, how much calories, it depends upon a lot of factors, not only the weight, but also your metabolism in the terms of your metabolic health. It also depends upon your physical activity, whether you're sedentary or you're already working out. There's so many factors. I think for that we definitely need to sit with the nutritionist and understand how much calories you need. But overall idea is to get at least a 500 calories deficit if you want to lose weight in a day. Whatever is
Okay.
required for you, minus 500 is required for the weight loss.
Okay, so balancing what you intake and how much you burn.
Yes.
At least a 500 deficit if you're trying to lose weight.
Yes.
Otherwise, you just stay at a plateau.
Right, right.
Got it. Now, the questions on home remedies, as always. We are in India. So, apple cider vinegar, honey water, methi water. Have you seen any of these working for weight loss?
No, not at all.
Okay.
Not at all. I mean, I would say if somebody is fond of drinking tea and having biscuits and all in the morning, replacing it with this might help. But it's not that this is the answer to that, right?
Okay. Great. Thank you for busting a myth there, Dr. Kaur. Now, the questions on brown bread, brown sugar versus the white versions. Are
Same.
they better?
All same.
All same, all
Same.
marketing gimmicks.
All marketing
Okay,
gimmicks.
good to hear. Okay, what about walk after lunch and dinner? Does it help lose weight?
Yes, definitely. So post meal walks have a huge role to play. As I just mentioned earlier, also, it helps improving your insulin sensitivity. So do go for 10-15 minutes walk wherever you are.
Got it.
Yes.
Then household chores. I do 2 hours of household chores every day. Is it enough as exercise?
Not enough.
Typical question for Indians.
Definitely not enough. You need to take out separate time.
Okay. Is weightlifting for men alone or can women do it as well?
No, women will do it. Women do it, and in fact now more and more women are picking on it. So this is again a big myth that this is just for men. In fact, women need more of this because they have already their build is much less than men, and their muscle is less, and they lose muscle at various stages in life, including your pregnancy and menopause, and so they need more of actually weightlifting and strength training, and women must incorporate this weight training. Yeah.
Got it. Yoga or gym, which one do you recommend?
More of gym, I would say. But if yoga can be added once or twice a week, that helps in flexibility. I would say a good combination always works. Yeah.
Okay. My doctor said I lost weight, but it was muscle mass loss. What does that mean?
Oh, yes, exactly. So in weight, we have two components, fat and muscle mass. So whenever you lose weight, definitely you lose more of fat, but there is a high risk of losing muscle mass, especially if when we're talking about these GLP-1 drugs, you have more chances. So for that, what we need to focus upon is again a good adequate amount of protein, maybe a high protein if you're already doing a strength training. And yes, the strength training itself is important to maintain the muscle mass. So especially people who have diabetes, aging, postmenopause, there is tendency to get muscle loss. So good protein diet is must for them.
Okay. And now there's an interesting question on vaping. Does it help suppress diet safely?
Not at all.
So all forms of smoking is a no from Dr.
no,
Kaur.
no, yes.
Okay, and if I'm unable to manage my sleep, is weekend catch up sleep good enough to manage my health?
No, no, that's not the answer. Weekend catching will not help at all. So, what we need is actually on a daily and a regular basis. That's again a myth that you sleep less on weekdays and sleep more. That's not going to help.
Okay, Dr. Kaur, so that brings us to the fag end of this podcast, but I'm very curious to know that how does Dr. Kaur manage her health? What are your golden tips?
Okay, wow. So let me first be very practical and very honestly telling it's a challenge. Like maintaining a health is a big challenge. We should accept it and then we should start working upon it. It's difficult for me as well, but somehow I got passionate about it around, let's say, 5, 6 years back when I first ran a very small run with my kid. It was like a tough kid. So kids went ahead of me and I was like behind and what's going on? It's an uphill run although. That's when I realized, okay, I'm so weak. My muscles are so weak. I cannot run. And that's where I picked up running. And when I picked up running, when I ran half marathons and last year I ran my first full marathon, I think that's how I think started liking it.
Amazing.
So that's where I think it's very important. If you like something, if you enjoy something, then it becomes more sustainable rather than pushing yourself hard. And the strength training I picked up when I did actually a study on sarcopenia. So sarcopenia is a loss of muscle mass which happens at my own hospital at Medanta, and I was like one of the controls, you know. And my muscle health was so poor as compared to the patients. That's when I realized, okay, I need to build up the muscle, and so I try to manage it. So my rule is not necessarily if morning time, especially for females, it's always difficult. Kids going to school and so many other home chores. I would say if not morning, pick up any time which suits you. So sometimes I do in the evening, sometimes in the morning, but I do make it a point at least 5 days a week I do my workout. Yeah.
So pick up a sustainable time and
Yes.
pick up an activity that you love.
Yes.
A lot of inspiration there, Dr. Kaur. Any last minute of advice you want to share with our audience today?
Yes, I would say it's very important to prioritize your health. It's very important. We get busy in work and so many other things, but unless you're healthy, you won't be energetic, you won't be happy, right? So prioritizing is where you begin with, and then you automatically will find time, you will find something to do. As far as the weight and obesity is concerned, let it not be a stigma, let it not be a cosmetic thing. We should accept that this is a problem, and if we start working towards it, definitely these things are preventable and reversible as well.
As I say, your health is your biggest asset.
Yes,
Thank you
yes.
so much, Dr. Kaur. It was so lovely to learn from you today, and we covered so many aspects of not just obesity but metabolic health. It was very enlightening, and I truly appreciate you spending time on conversations with Zyla.
Thank
To a
you.
lovely audience, thank you so much for this interactive session. We'll see you again on the 22nd episode. Till then, take care and take care of your health.